Thank you. I now request Honorable Minister, sir, to kindly deliver the inaugural address.
Guests on the dais, Dr. Abdul Ghafarji, Dr. Bhatt Kail, Dr. Sanjeev Kumar, Dr. Ravindranath, Dr. Vimala Patel, and the man behind all this function, Dr. Devdasan, all the dignitaries of the dais, representatives who have come from throughout the nation, state and international delegates who are here, and press media persons who have supported me all through my care of 3 years, and all my department officers and doctors. At the outset, I congratulate and thank Dr. Devdasan and the IPH and all these organizers of this function for having a wonderful 3-day seminar. And I am sure that you are sharing your knowledge and having the network. After 3 days, the outcome of this seminar will help the public sector in the society, where how the health sector can come forward in much better way, so that the implementation will be effective in the down level. So until the other day when I was health minister, and I'm very happy I'm the food minister, because instead of going to some other ministry, food is more important to health. So it will connect from food to give good food, the people will be healthy. And that is my primary duty, to see that. And I always say, because when it is, even if I'm out of the ministry, it is my duty to take the knowledge whatever possible, and wherever it is, we get that knowledge. And they only add X. I used to tell before with my panchayat, my colleagues and my party, my members and my panchayat and this corporators and all, when they become X, so I should say, when you are in power, you should work in such a way so that when you are X, that doesn't mean you are gone. X means extraordinary, you as a member of, like they should be, and gay, so you should come extraordinary, you as a member of parliament, it's like that. X means it has come like that. People should remember when he was in the power, he was extraordinary. And that was what I used to tell my colleagues and my friends, when all the corporators and other people we used to have. And now I'm very happy because of these 3 years what I've got. And I have to thank all my department, from my secretary to my ASHA worker to DM level, and all our public, like our Devdas and all the public, Vishal and all the team was helping us in giving the knowledge to ministers. Because I always say, as soon as we become ministers, we don't get extra brain. We have to work with you, take your knowledge, get an experience, and deliver to the people. So that was our mindset. And all have helped us to become, to deliver all these things effectively, especially press media. Whatever good things we do, they support. Any small mistake, they have to target, and they have to ask question and rectify us also. So it is their contribution also. We are come out a bit perfect today. And I'm very happy after 3 years, because now I get calls from the smaller level. Today all from ASHA workers, they call and tell, when you come here, we have given extra facilities, incentives. Doctors, they call and tell, before around 60,000, you have done it 85,000, we can't forget this. And dental people tell, from 20 years, we never had dental doctors. You have bought a health policy and had appointment after 20 years in dental doctors. So from every sector of the department, one or the other, that and all the my nurses there will not get a promotion from 13 years. You came and give the promotion, all 135 credit system was there. I think this is all, when we work with commitment, when with efficiency, this will be always remembered in the society. So thanking each and everyone regarding that. And regarding this conference, I'm sure that this conference, after the 3 years, having good discussions and various aspects throughout the India and throughout the world, I'm sure it will affect in the society, and that should come. I always say public health means two. It is a preventive and curative. We have to work on 2 measures. First, our duty was to see that no one will get disease, and to reduction and control and preventive measures should be our fresh criteria, and that should be the aim of each and every one. Because without preventive and giving medicines to all who get sickness, it doesn't help in the healthy society. I always say we don't need health society where a lot of hospitals come up. Is not a health city. We want a healthy city where people are healthy. If hospitals come up, our intention was not to build more hospital. Our intention was we have to see the situation where less hospitals come down and more healthy people will be there where they don't get disease. For that, we are all these preventive measures concerning, and it should start from early. As we are saying, concerning the Gurkha, why we have banned this is when we had discussion. And one way we used to spend a lot of money for cancer treatment. One way is we spend thousands of crores on research for the medicine for cancer. In other end, we give 2 rupees gudka and tell you take gudka and you die. So it was better to put an end in one part. So, and that was the first experience, as Dr. Vishal said, that was the first month of my government. And there's a lot of pressure and a lot of issue, not only on the same also, not on the lobby, concerning the inside. And some they used to tell, why didn't you get into the cabinet? Why did you not go our notice? Some they used to tell it is not what the legal opinion, law department not given. And all this, but the CM supported wholeheartedly, and he gave the full support for that. Congratulations, and I appreciate that, and I remember also. And some says to say always he is very young, he doesn't have experience, and you are given such a ministry for a person who is not experienced at all. Today we have to face the society, and tomorrow elections will come, and this will has done without asking anyone. And CM called me once and he said, how it will be, I have to answer in the assembly. Are you prepared with the answer, this one? Don't worry, he said. I said, yes. Then once I gave an answer, not only our chief minister and our members, the opposition also appreciated the initiative taken. And the biggest thing was, one aim was there, the reckoner price will come down. And we argued that it won't come down. And luckily, after that, the reckoner price has gone up. This shows that whatever we do for the public cause, God also will help to see that nothing will happen to the initiative taken on the interest of the public. Regarding the other diseases, like all the preventive measures, I think the public awareness is very important in the society. It is there, but still it should be needed from the down level. See, it is a healthy mother is a healthy child. I think, sir, if we target on a healthy mother concept, automatically healthy child will be there, then the society will be, we can change with 10 to 15 years, we can have a change. And the awareness among the mothers and the child also is very important, considering the cleanliness, environment, and the food habits. As you know, the lifestyles and food habits are more important. Considering this, more awareness should be needed, so that for this always used to say, it's not only health department, the education department should be there, the rural development, the communicable diseases. What can health department at the most can do? The communicable diseases, where Octagon and these diseases come out, it is the primary duty of the rural development, in the urban development, to see that no unclean lake is there in the city. The drainage system, what water flow should be on the perfect. The solid waste management be managed correctly. Without having cleaning the lake and without having the system where the rainwater flows or the water goes down, without giving the awareness to the people, and without having this solid waste management proper way, how can you say community shouldn't come out? So it's a primary, the problem in the health sector, malaria, dengue, chikungunya is not a problem. The problem is the solid waste management and the drainage system, and this unclean lake is a problem. Until you have a solution for that, you won't get a solution here. Only we can give the medicine, those who get disease, free of cost, and that will be, we can say, considering the health. So it is their measure should be there. Concern malnutrition also, it is our department also should take initiative. Because usually before I used to day and I only think of health, what to do. That was my, wherever I go, whatever. Mostly my aim was there. Now I go and think about food only, what to do, what is my initiative, how can we help, wherever I go, any instant I take. So I think it is our department also should contribute concerning the health, because I always say, I just had a discussion and see, we give only carbohydrates in the ration shop for the poor. We don't give proteins. It is our primary duty of the government to give proteins also. And I'm sure that in the days to come, we'll put up a file to the CM. So part of proteins also should be given. We have to balance the carbohydrates, only giving carbohydrates, and I think it won't work. So we have to see on this sector also, where the people, whatever food they take, they should be healthy, and the quality-based food also should be given. So we are planning on that sector, and various other things also coming up mine until I get the discussion. Because the other day I went, and usually very rarely I get time to go out. The other day my Ramzan was yesterday, so other day night I went little early home. I, my daughter and my missus went for a drive and went for a restaurant. I parked the car outside. And I saw a lady, in that rain also she was fully wet, and this one known is there with she was talking to something as if she is not well. And she was just sitting there, she not see her, she's sitting there thinking, seeing people and all. And I was feeling something, looking at this, something should be done to such people and all. And when the waiter came with the food, and when I just put my car window down, from where she came, I don't know. Suddenly she came, she took the food away and went. So that time I realized there are many people in the city who sleep without one food at night. And it's a primary duty of the government to see that no one will sleep without food at night, and that program will be bought by the food department in the future days. That I'll be, this one. This is, because we have to see that no one will be in the city. People come from far away. We don't know where are they. On the street they sleep. But let them live on the street. It is housing department issue. But I should see that those who sleep on the streets will have at least one food. And without food, they won't, with the empty stomach, they won't have a sleep. That will be my initially concerning the future days. Again, the biggest problem is, I have come to health, I am talking of food here. So what I like to say concerning the health is the preventive measure and the curative measures. Preventive measure awareness is very much important in the education system and all. Even the children, they don't know. Whatever we parents and we give, they eat. You give food, good food, it will be habit for them. If it is a bad food which they get disease later, even they'll take that also. I usually tell in all my speeches also. Because you go to a function, you come to a function like this, you see anyone eating sweets and ice cream, you advise him, you don't eat sweets or ice cream, you will get BP or you will get sugar, you will get diabetes. He'll tell, if I die also no problem, today one day I'll eat. The problem is, we can't change our taste of our tongue. The taste of the tongue, which we are going from small only, which was built up, we can't change easily. When we at least once we'll say, today I'll eat, tomorrow we'll see what happens. That is the situation is calm. And this, so the mothers should be educated and their awareness should be brought among the mothers. Starting when the delivery take place, and this one, you see, it is your primary duty to see your children are not only become plumpy, they should be healthy in the future days to come. And this should be our food habits and lifestyle. And I think this can change, a lot of change in the days to come. And one should think in compulsory, the BP and sugar, compulsory at least once in a year should be checked of each and every individual. Let it be anything. When they want to see in license, they'll ask what is your blood group. So they should ask, when you renew something, you should ask this also. Other when they go for a college education, for there are a lot of forms. One criteria should be there. What is your BP and sugar this year? And that should be tested. And they should I should know what is my BP and sugar. After 40 years, it should once in 6 months. And that should be we should do it mandatory. Why mandatory? If we tell you do it, again no one will at least bother. Because as soon as I taken my ministry, I said one thing, that each and every individual will go to a primary health care and there we'll have a free test. Within 10 minutes we'll let you know what is your BP and sugar. And we said all our departments should be ready. What is my disaster? No one is busy, no one has time, no people have got time to go to the PSC. They go to hotel, pay money, wait half an hour, then they eat what disease they'll get, that food they eat. But they don't have time to go and test what is the BP and sugar. If people doesn't have half an hour time for their children and for them to concerning the health and education, then who will give time? If I don't give my time or my wife doesn't give my time to my children for health and education, for the cleanliness, no neighbor will come and no one will give. So it's a primary duty to see that this awareness should come along with from the children and mother. About 5 to 6 years that takes place, I'm sure there's a drastic change that is to come after 10 to 15 years when small children comes up. So this is one of the preventive issues where you have to take and go, and a lot of other issues also should be there. Concerning the curative measures, we decided whatever our primary thing is to be prevent. If not prevention, then what to do? If some will come hereditarily, it will come. This will arise. That time they should be peaceful of having without tension, they should get a treatment. See, and government hospital is not all super specialty hospital. A PSC is a PSC, or small disease will come, they'll treat there. A taluk level hospital is a taluk level hospital. It is a primary, secondary care. And the district level hospital is a district level hospital, where they'll get treatment for few of the diseases. It is not super specialty hospital. So that was the biggest problem for the people when in the area like any place other than Bangalore, because super special hospitals like Kidwai for cancer, Jayadeva for heart, Indira Gandhi for children, Ranji Gandhi for chest, and Sanjay Gandhi for ortho. This is only, it is approachable to only people who live in Bangalore. No other cities have such a government super specialty hospitals. Then it was decided the insurance scheme should be bought in the state. So BPL, it should be free of cost. For whatever facilities we can't give in our district hospital, that should be given in private hospital also, where the government will pay on behalf of the poor people. Who are below poverty line, they will have 100% free. And then we have decided not only BPL, we should get for above poverty line people also. Because I usually say, because when I had a discussion with CM, and regarding that we should give schemes for the APL also, some of the finance people said, what will be the situation? In Karnataka, if you give all schemes for APL and BPL, universal people, if you give health coverage, what if the financial problem will be there? I said, CM, there are a lot of APL people. They are APL when they get disease. When they get disease and they go to hospital and pay the bill and come back, even they will be BPL. That is a problem here. So it is a primary duty to see that, the welfare state's duty that all will be APL, that no one will come to BPL. Regarding that, first time in India, and now we are the only state in India where both APL and BPL got a health assurance scheme. And I think this has helped a lot of people throughout Karnataka to get the treatment peacefully and come out even if they got like big diseases. So these are some of the initiatives taken. Concerning the other initiatives like bike ambulance and every initiatives or plan, a lot of initiatives were taken. Everything was only on the people concerned. Where people had a problem, we solved that. When I had visited a accident had taken place, and I visited that house, that mother came and told me, the doctor said, if the ambulance had come on 15 minutes earlier, your son would have been saved. Because of due to the delay of ambulance in the city areas, we couldn't rescue your son because in the density people. Then we decided, we had a discussion. If we sit at home and we order for a pizza, within 10 minutes the pizza will come to a doorstep. Then why can't healthcare go within 10 minutes? Then when we had what we can do, then we had a bike ambulance. So the first time we bought a bike ambulance and very happy, entire system was I only designed. The paint, the bike and whatever should be there, every discussion, and which has come out successfully. Now where other states also are taking and other countries have asked for us the model how we can take away. So I think the policy makers, if they sit with the people, see what is their problem and start solving that, I think one of the best schemes and everything can be bought. And regarding various other programs also, I'm sure that I don't want to take a lot of time regarding this. I'm sure Dr. Devdasan and team and all who have joined here will have various schemes which will help to the people. And one thing we should assure each and every policy makers, medical care is different, health care is different. You can't mix both medical care and health care. Medical care is a medical care, how to build hospital, what are the equipments, how to train doctors. Health care is separate, where the health society, where everything should be taken. Curative measures, preventive measures, all other malnutrition issues, all should be discussed and action consent to be taken. And even the people awareness is much more important, because when I used to discuss with the doctors used to come and say, now the public mindset is so much. Before, if any heart patient comes, and after testing, to tell him you need heart operation, it takes him half an hour for a doctor to convince him why he needs heart operation. This is the problem, this is the issue, this is so you should go for a operation, you have to go. And now the doctor say, now to tell the patient you don't need operation, I take half an hour. Because they come and tell, operate me only. Because that psychology has come in such a way, all the, without treatment and so on, like operation, it cannot be cured only. So all these changes of this, the time and all these things also are concerned to all this. So whatever problem you go on solving, new issues are coming up. And I'm sure that all will have a capacity and the strength will be there to all solve these issues. And Karnataka, I am very happy this program takes place in Karnataka, and I appreciate the initiative department also helping you all. And I am very happy also now my who has come as health minister, one of the most senior and most sincere and very good support he will give to you also, because he was my colleague with my dad. My dad was MLA from 1972 to 2007. He was from 1978. So we are close friends, and I'm sure that whatever initiative we have taken, it will be speed up way, it will go forward and distribute the people as to come. Few of the other initiatives also there, generic medicine 24/7, generic medicine open pharmacy, which was appreciated by the central government pharmacy department, their call me issue taken, and Shraddhanjali vehicle. I have seen in government hospitals, after death, if the poor people, either that if a husband dies, mother and 2 children will be there, 2, 3 children. If a mother dies, husband and children will be there. If anyone is not, the only children will be crying. Crying for what? To take their dead bodies from the house from the hospital to the house. They won't have any money, they go to government hospital. Suddenly someone dies, they go outside the gate for the ambulance. The biggest problem with the ambulance people also, private ambulance, when they hear that the patient is dead, their rate also is double. This is the biggest problem. So I decided, a lot of people I used to see, they sit and cry because they don't have money to take their dead body. And a lot of phone calls were there. Then I said we should have an ambulance which will take the government hospitals only to take dead bodies, and that name was on Shraddhanjali. I think that also is ready. In the days to come, only we have to start. And the help, he has said, helping the patients who on the accident case. I think we tried a lot of awareness to see that no one will die on the road because he was not taken away at the earliest. And that awareness given that you go and help and you put them in the hospital, you won't have a problem. Still there was problem was there. For that we had brought an act, Good Samaritan Act. Along with the act, we wanted to give some type of initiatives. See, if I help a patient on the road, I go and put him in the hospital. If anything needed, if I don't have money also, whatever is there, I'll pay in the casualty. And I go home. Later, he doesn't know me, I don't know him, what is, and that helping nature and due to some other problem, that initiative to come down. We never wanted anyone to just see and go who is on the roadside. We said Jiva Rakshak award will be given, so that every district, any patient, anyone will be taken, he will give a certificate, so that the connections, relations between the who has been admitted and who has admitted, that will be there lifelong, that remembrance will be there. And a state level award in once in a year, where it will be such a big case, will be awarded, so that inspiration will be given to the people to help in the place on their distress in the road. So all these have come out because of all the support of the people who are there. I'm sure this will come out in much better way in the days to come. And concerning my, as you have said and suggested, all the other in policy making, other department also should be involved. I am for that, and whatever is needed from the food department, I am there to give the support concerned. The health department is concerned. And why I said I'm very happy with the food is, this is one of my very intense subject. Before me become MLA, and my dad was an MLA, I used to go and stay in queue and take the ration card and give to the people. For my constituency were not got from many days by shouting to these DDs and why questioning them, then give one. Because people, they're ready to give anything away, not their ration card. This is what like they keep in that village people, that old age ladies, they'll never keep it with someone else. So it is a primary duty to see that, and which will be directly helping the concerned people. When the Chief Minister asked me early morning, 6 o'clock, called me to his house and said, I said, I agreed. So I am happy, sir. I am happy with the civil. I am ready for that. And I am sure that even this we can work out in much better way, which will reaching to the society. So I thank once, and Vishal has already has given all his speech and what to say regarding me. I think this is what he has told, what work we have done. Now go and do better work in food sector. Otherwise what you have done here, if you don't here again, you also will go down. And I think again I have to start working more and more. And after all these 3 years of all this suggestion, programs, implementation, thinking and making policy. Now one thing I'm concerned. Any disease, except for giving for medicine prescription, I'm a doctor only. Okay. Only that is not possible in rule. Others I can give prescription also because I've studied so much. So thank you each and everyone for having this wonderful function over here. Wishing each and everyone a Eid Mubarak festival. And I appreciate Abdul Ghaffar ji also. I had met him in South Africa. Even though our Ramzan is there, because of all you invited him and his interest in this public policy concerning the health, even though his festival is there, he has left his family and come and he has joined here. This shows the commitment, sincerity. Once again, on behalf of people of Karnataka, we wish you Eid Mubarak. Thank you one and all.